What is Cetrotide? Cetrotide, cetrorelix acetate, is a synthetic decapeptide with gonadotropin-releasing hormone, GnRH, antagonistic activity. It's specifically designed to block the effects of natural GnRH, preventing the surge of luteinizing hormone, LH, that would otherwise trigger premature ovulation. This medication is administered as a subcutaneous injection during fertility treatments to maintain control over the ovulation process, ensuring eggs can be retrieved at the optimal time. What are the benefits and uses of Cetrotide? Cetrotide offers significant benefits in fertility treatments by providing precise control over the reproductive process. Its primary function is to prevent premature ovulation, allowing eggs to develop fully before retrieval. Conditions Cetrotide treats. The main condition treated with Cetrotide is female infertility, specifically during controlled ovarian stimulation as part of assisted reproductive technologies such as IVF. By preventing premature ovulation, Cetrotide gives healthcare providers greater control over the timing of egg maturation and retrieval. Secondary uses of Cetrotide. While primarily used in fertility treatments, Cetrotide is sometimes used in other hormonal therapies. It's particularly valuable in fertility protocols that require precise timing and hormone management. How does Cetrotide work? Cetrotide works by competitively binding to GnRH receptors in the pituitary gland, blocking the natural GnRH from activating these receptors. This prevents the release of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, from the pituitary gland. This mechanism effectively stops the LH surge that would normally trigger ovulation, allowing for controlled follicular development during fertility treatments. The medication's antagonist action is immediate and does not cause an initial stimulation effect, unlike GnRH agonists. How to use the cetrorelix kit? Before starting cetrorelix, read the patient information leaflet provided by your pharmacist. Consult your doctor or pharmacist for clarification on any doubts. Instructions. Shake the vial gently before use. Inject the medication under the skin, subcutaneously, as directed by your doctor, typically once daily. Administer the injection into the stomach area, at least 1 inch away from the belly button. Rotate injection sites to minimize skin damage. Follow your doctor's instructions on timing and duration of treatment. Store and dispose of medical supplies properly. Cetrotide dosage. Cetrotide is administered as a subcutaneous injection with specific dosing protocols depending on the treatment plan designed by your fertility specialist. For adult, dosage forms and strengths. Injectable solution. 0.25 mg. 3 mg. Infertility treatment. Single dose regimen should be 3 mg SC. Serum estradiol levels show appropriate stimulation response, which is day 7. If HCG not administered within 4 days, continue dose at 0.25 mg/day until HCG administered. Multiple dose regimen. 0.25 mg SC 2 times a day, morning or evening of stimulation day 5 or morning of stimulation day 6, continue until HCG administered. For pediatric use, it is not recommended. What should I do if I miss a dose of Cetrotide? If you miss a dose of Cetrotide, contact your healthcare provider immediately for guidance. The timing of doses is critical for successful fertility treatment, and your doctor will advise you on the appropriate action to take. What happens if an overdose? There have been no reports of overdosage with cetrorelix acetate in humans. Single doses up to 120 mg have been well tolerated in patients treated for other indications without signs of overdosage. However, if you suspect an overdose, contact medical services immediately. What are the side effects of Cetrotide? Most patients tolerate Cetrotide well, with side effects typically being mild and transient. However, understanding potential adverse reactions is important. Common side effects include nausea, headache, pain, redness, bruising, or swelling at the injection site, mild abdominal discomfort. Serious but rare side effects. While rare, serious side effects can occur and require immediate medical attention. Ovarian hyperstimulation syndrome, OHSS. Symptoms include severe abdominal pain, bloating, nausea, vomiting, rapid weight gain, decreased urination, and shortness of breath. Severe allergic reactions, rash, itching, swelling, especially of face/tongue/throat, severe dizziness, or trouble breathing. If you experience any severe or persistent symptoms, contact your healthcare provider immediately. Precautions and warnings. Who should avoid Cetrotide? Cetrotide should not be used by pregnant women or women who suspect they might be pregnant. Women with known hypersensitivity to cetrorelix acetate, mannitol, or similar peptide hormones. Women with severe kidney disease. Conditions where caution is needed. Exercise caution when using Cetrotide if you have a history of allergic reactions, kidney disease, liver disease. Are there any age restrictions for using Cetrotide? Cetrotide is approved for adult women of reproductive age undergoing fertility treatments. It is not indicated for use in pediatric patients. Alcohol or food interactions. There are no specific food or alcohol restrictions when taking Cetrotide. However, maintaining a healthy lifestyle is recommended during fertility treatments. Possible interactions with other medications. Cetrorelix may alter the effectiveness of other hormone therapies or interact with supplements that affect pituitary function. Drug interactions. Always inform your doctor of all prescription, over-the-counter, and herbal products. Supplements/herbals. Products containing phytoestrogens or other hormone-modulating agents may require dose adjustments. How should Cetrotide be stored? Proper storage helps preserve the effectiveness and safety of Cetrotide throughout its shelf life. Keep it in recommended conditions to prevent loss of potency or degradation. Recommended storage temperature. Store Cetrotide in the refrigerator between 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. Keep the package tray in the outer carton to protect from light. What happens if Cetrotide is not stored properly? Improper storage can reduce the effectiveness of the medication. If Cetrotide is not stored correctly, it may degrade and become less potent or ineffective. If you suspect the medication has not been stored properly, consult your pharmacist or healthcare provider before using it. Keep Cetrotide away from children, direct sunlight, and moisture. Do not use after the expiration date printed on the package.